deaths in the country. The leading contributor to the deaths is the lack of blood in the county blood banks.
At no particular time do we even have a surplus of blood. Yes. It's always borderline that a mother requires 3 units of blood. The most you can get is 2.
Last year, we had 2 mothers. That's the last quarter who died because of bleeding. In the last quarter, we had both antepartum and postpartum hemorrhages up to 100, over 100 clients. To be precise, 132.
This grim reality is embodied by Barry Salis, a journalist, widower, and father of 5 who lost his wife due to lack of blood in hospital when she was delivering. We met him at his home in Nandi County.
She was expectant. Suddenly, she developed some complications. She developed a pressure. Her pressure went up. On examination, she was told she had mild malaria. Within no time, she was informed that the fetus was no longer alive. Reaching there, I was told she needs blood.
Like many other Kenyans in his situation, Barris passionately reached out to family and friends to donate blood in a bid to save her life. But even with willing and ready volunteers at hand, nothing much could be done for his wife.
I had about 4 people who were ready to donate blood to save her life. Yeah, they came, they were around. Unfortunately, I was informed that the people who were supposed to lead the blood donation procedure were not there, the technicians. And secondly, I was told there were no reagents. Even if blood was there, there were no reagents. So she was a very strong lady. She told me, bye, I'm gone. Take care of the children.
15 years on, Barry's bitter memories are retriggered by national and online blood appeals.
And since that time, this blood issue, it keeps on haunting me.
Barry's story is not unique, as postpartum hemorrhage is the leading cause of death among mothers in Kenya. In Kiptidil village, Nandi County, we meet Bila, a 27-year-old mother of 2 who gave birth just 3 months ago. She knows too well the pain and trauma of bleeding after giving birth.
Nilizaa vizuri kabisa, lakini niliposaa tu hivi mtoto venye alitoka, nikaanza tu kubleed hivyo tu. Nikableed kuanzia saa 10 hadi saa 12. Hapo sasa ndio nikatolewa kwa hiyo hosi, nikapelekwa district. Kufika district, nikashughulikiwa, mzee akatoa damu.
The efforts would, however, prove to be futile as the facility doesn't screen blood. Consequently, Bila was referred to Riley Mother and Baby Hospital in Eldoret, some 40 kilometers away from Kapsabet, while still bleeding.
Kitolewa hivi kwa kitanda, nikipeleka kwa wheelchair, fahamu inapotea kabisa, sioni chochote, sisikii chochote. Eldoret penye nilifika, nikadungiwa dawa siku ya kwanza, siku ya pili, siku ya pili ndio nikaongezwa damu.
Like many mothers, she can hardly mask the traumatic ordeal. In her eyes, telltale signs of the pain linger on. For her, the onset of the coronavirus led to delays in admission at Riley Mother and Baby Hospital, where she had to be isolated and tested. By this time, her patience had run out.
Story nikisema huwa nasikia tu machozi inaweza toka. Nilikuwa nimeamua tu niwachie mama mtoto because venye nilikuwa nimefikia nilikuwa nasikia ni kama sitarudi tena. Despite the ordeal, Bila is one of the lucky few. Some mothers have had to pay the ultimate price. In Ainamoi village, Kericho County, we make way to this homestead. They seem happy, but masked between the moments of interaction is a lingering pain that only a mother can understand.
We meet Maureen Chebet, 36-year-old mother of 5. In 2017, she lost a baby after excessive bleeding at home.
Ilianza tu na dakika kidogo mimba ikatoka. Alafu mtoto akakufa. Mama yangu akaita gari ya jirani kanipeleka hospitali.
Maureen had to travel from Ainamoi to Kericho and then to Leitane, bleeding all the way, losing liter after precious liter of blood. By the time she got to hospital, she needed 5 pints of blood, a situation compounded by her rare blood group O negative, of which the hospital only had 1 pint.
Siku hiyo tulikuwa tunaongea na daktari kidogo, hapo kidogo nikasirai. Daktari akangoja mpaka niamke tena ndio tuendelee kuongea.
Her relatives came to her rescue and donated blood, but it was a long wait. This painful lesson saw her go to hospital early to get her blood levels in check before she delivered her last baby early this year to avoid going through the same ordeal.
Wanaimiza wa mama, ukisikia tu ama unajua tu kuna mimba, usingoje atifike hizo mwezi za mwisho ndio wanaenda hospitali. Na waamisa waende hospitali wakijua tu kuna mimba.
Sad stories of Baris, Bila and Maureen now begging the question as to how exactly the country found itself facing such dire blood shortages. Kenya's first blood bank was set up in 1998 by the US government after the 8th August terrorist attack in the US Embassy in Nairobi. The elaborate network comprised of a head office at Kenyatta National Hospital and 5 regional centers in Mombasa, Kisumu, Eldoret, Embu and Nakuru, alongside 22 satellite centers spread around the country. The service was funded through the US President's Emergency Plan for AIDS Relief PEPFAR and the Centers for Disease Control and Prevention CDC Kenya to a tune of 850 million shillings a year. The funding was to run for 17 years, with the Kenyan government expected to take over through the Ministry of Health. The funding was reduced every 5 years and was ultimately terminated in July last year, seemingly catching the Ministry of Health unawares. The current national demand stands at 400,000 units per year. However, according to the Kenya National Blood Transfusion Service, KNBTS, blood collection stands at around 150,000 to 200,000 units a year. In 2018, only 164,000 units of blood were collected, representing a paltry 16% of what is needed based on World Health Organization, where Kenya should be collecting as much as 1 million units of blood a year. Kenya's population is 47 million, so even if just 1% donated blood, the country would have at least 470,000 units. The situation is dire at county level. For instance, the satellite Nandi Blood Bank, which is located in Nandi Hills and operates under Eldoret Regional Blood Transfusion Center, has had to lower its target to 100 pints of blood due to COVID-19, which resulted in the closure of schools, which are the key donor base. But even below target is release on the Eldoret Regional Blood Transfusion Center, where it sends blood for screening. Add to that a lack of proper and adequate storage and lack of blood separation equipment.
The first big problem is an equipment that is a centrifuge that separates the whole blood so that you can get back cells. So at the moment we only give whole blood, which is not that good to our patients. Then the other thing is a fridge. This one is faulty. If you can get a fridge for reagents, it will be good for us.
Due to delays of screening of blood, they have to discard these units of blood as they are not safe for use anymore. Normally, blood expires after 35 days. This leaves the satellite with only 2 units of blood that is screened and available for use. Though it only takes 10 minutes to donate blood, most people remain reluctant. According to KNBTS data, 77% of those who donated blood in 2018 were first-time donors.
Nilikuwa nimeona kulikuwa na crisis ya watu kutokuwa na damu, ndio nimeamua kuja kutoa.
I always donate on 14 February. Siku ya Valentine's, juu natoa kwa ajili yao wenye nawapenda.
In Kapsabet Referral Hospital, one of the largest hospitals in Nandi County, we meet Joyce Chelagat, a laboratory technician working in hematologist department, cross-matching blood that is urgently needed by a patient. During our visit, the bank had only 11 pints, comprising of 2 pints of blood group AB, 2 pints of blood group B, and 4 pints of blood O positive. Blood O negative, which is said to be rare, was not available, and in case of an emergency, they will have to call the Eldoret Center or transfer the patient to Moi Teaching and Referral Hospital in Eldoret.
When the HB is not within the normals, that is the normal for male is 13.5 to 18. For females is 12.5 to 16. And when the ranges is below 7, then that is an emergency case, the patient needs blood.
But despite the size of the facility, they are equally reliant on emergency blood donors who are mostly relatives of patients.
We bleed donors in the MCH route. We have a bleeding site. We bleed the donors. We take the blood to Eldoret for screening, because right now with us we are not doing screening.
Nandi Hills Satellite and Kapsabet Referral Hospital Blood Bank and other blood banks in Lodwar, West Pokot, Trans Nzoia, Baringo and Elgeyo Marakwet all depend on Eldoret Regional Blood Transfusion Center. But this center is also facing problems, same as the satellites, delays from KEMSA to supply them with blood donation equipment like blood bags and reagents. This has derailed its function.
A regional blood transfusion center, we are collecting blood, but it is not enough.
This regional blood transfusion center collection target is 2,800 units per month, but at the moment, the far it can go is 1,480 units, just half of the required amount.
Our cold room can take up to even 6,000 units. And with the fridges that we have, averagely we can store around 7,000 units. And it's difficult to achieve that 7,000 units. Blood expires after 35 days. With the current demand and high demand for blood, there is no blood which is even stored for more than a week.
Though the center has capabilities of monitoring blood usage in hospitals, they dispatch too, but lack of finances has been a thorn in the flesh to this center.
Currently, as a regional center, we don't have any budget. And all the supplies are procured from the national office. The only budget that we have is maybe for the local consumables.
Since the facility is partly funded by MTRH, they are given the first priority. On our visit, there was no screened blood as it was all dispatched to MTRH, a factor that puts it at odds with the satellite centers dependent on it.
The main challenge is delay of testing from the regional blood banks. And there was a time we had a shortage of testing kits across the country, not just in Nandi County. So the testing being delayed?
For delay, maybe when machine has broken down. Currently, I'm waiting for an engineer to come and repair our screening machine. But I don't think we have delayed deliberately. In fact, for our counties, our satellites, we really ensure that we screen for them. When machine is down, I cannot produce results. I'll wait until the engineer comes all the way from Nairobi, repair the machine, and I continue screening.
The challenge is not unique to Nandi County. We tour Kericho County, a county with a population of approximately 1 million people. Here we visit a 200-bed capacity missionary hospital in Letaine, providing both inpatient and outpatient services. Here, access to blood is a challenge for obstetrician cases and cesarean surgeries.
We work closely with the Kericho Satellite Blood Transfusion Center, which also works with the Nakuru Regional Blood Transfusion Center. Unfortunately, our consumption has not been met.
Even here, relative and blood donors are sent 31 kilometers away to Kericho to donate blood and have it screened before it can be sent back for transfusion. The facility handles 150 births every month, with 25% of them give birth through cesarean sections, a procedure that requires blood most of the time.
Specific note of a mother we were almost watching to die, but we couldn't. And we had to consult even the county government and our senior consultant from the county, obstetric and emergency consultant, that is Dr. Terer. And it reached a point where we had to bleed our own staff to save the life of a mother.
Anytime a cesarean surgery is done, a relative has to be present and donate blood before the procedure takes place, or if the blood is not available, sometimes the doctor takes risk, hoping the patient won't bleed so much.
There are times when we may have to delay a day or two. We call everywhere. We call Kericho. Sometimes we call even up to Kisumu and Nakuru to see if we can get some blood, or even our neighboring hospitals to assist us to get some of the units that we require. We give fluids that will help to increase the volume for the patient so that his blood, they don't go into shock. Meanwhile, as we sort out where to get more blood for that client.
Due to the low supply of blood, it is often claimed that private hospitals sell blood, though it is a free commodity, a claim Dr. Munala refutes.
As a private hospital, we don't charge for blood, and that the only cost that is incurred for the accessories that are used maybe to draw the blood from the patient.
According to the Kenya National Blood Transfusion Service, KNBTS, 60% of all blood donated in Kenya is used up by mothers and children. But more often than not, access is paged on availability of donors. In Kericho, we meet Doreen Chelangat, who has just finished donating blood to a relative who needs it urgently in Kericho Referral Hospital.
Nilipigiwa simu na dadangu. Akaniambia mtoto mgonjwa na damu inatakikana. Sasa nikajitolea nikakuja.
She was told there is no enough in the hospital, but a tour at the Kericho blood satellite, indeed, there was no screened blood as it was all dispatched to hospitals that are in need. The remaining blood in this fridge is unscreened, waiting results from Nakuru Regional Blood Center, where blood samples are always sent before the blood is dispatched to hospitals. The county has 5 hospitals that offer both basic obstetric care and comprehensive care. 4 health facilities are able to do blood transfusion and cesarean surgeries. They include Kericho County Referral Hospital, Kapkatet Hospital, Sigowet Sub-County Hospital, Londiani District Hospital, and AIC Litein. Even with these facilities, Kericho County recorded 23 maternal deaths last year.
76% of the mothers we lost because of bleeding. There's been a challenge in terms of blood because there's been blood shortage. We are not talking only about Kericho County. There's been a blood shortage in Kenya in general because of issues in terms of reagents to process and to screen the blood.
To remedy the situation, the Maternal and Newborn Improvement Quality of Care project that was mooted, the project works well with health facilities in Kericho and Nandi County to reduce incidents of women dying from postpartum hemorrhage due to shortage of blood by partnering with county governments to offer supplies and improve quality of institution care.
The mother either comes and they are bleeding before delivery or during delivery or after delivery. And therefore, the only way you can work towards actually saving this mother is the mother has lost blood. So the mitigation is to replace the blood lost.
Hospitals are not allowed to collect or test their own blood. The KNBTS is exclusively tasked by the government to regularly collect, test, match and distribute blood and blood products at no cost to patients. But the counties are now appealing the Ministry of Health to allow them to be able to collect and screen their own blood so as to curb the shortage being experienced.
We would really request that if the Ministry of Health could allow the counties to be able to process, to screen their blood or contribute towards procurement of reagents so that we don't have a lot of shortage.
Blood bank services should be totally devolved. It is one of those functions that, yes, we can have regional blood banks. But for me, I think that if every region had their own regional blood bank services, it should be able to support the satellite blood bank services mashinani.
According to a report by Mani QC, maternal and newborn health services are among the top 3 consumers of blood in the country. Those who need more blood are anemia patients, then transfusion for general causes like accidents, then maternal and newborn health.
If you look at the 2019 maternal deaths, 46% of the women
who died. Among the over 2,500 actually died because of hemorrhage. And therefore really having safe blood available for transfusion is very key in provision of maternal and newborn health services.
Money QC project conducted a rapid survey in 4 counties, that is Kwale, Kilifi, Kericho and Nandi. The assessment included 1 regional blood transfusion center, 3 blood satellites and 23 transfusing facilities, with the purpose of assessing the capacity of health systems to collect, store, screen and utilize blood in hymovigilance process to meet the patient's needs.
As a country, we need to look at actually mostly using blood products so that you're able to use blood efficiently. Number 3 is our hemovigilance systems actually still have some gaps that needs to be strengthened, and this can be done through training, capacity building and even mentorship. And for me, the biggest challenge is consumption of blood is not actually reported in the national healthcare provision system, and yet it is a product like any other medical supplies that needs to be reported, and therefore I think there is really an urgent need to incorporate blood transfusion and services into the national health reporting systems.
The report also found that almost all blood transfusing facilities are experiencing shortages, except private facilities which have screening capabilities, little or no capacity of counties to process and use blood components, poor reporting and monitoring, limited forecast of what blood levels are required by facilities. The report further recommends KNBTS review the policy framework that guides relationship between KNBTS and counties, strengthening the surveillance of blood services. They also call on county governments to ensure they have blood satellites in their counties, allocate budget for hymovigilance. They also call on county governments to ensure they have blood satellites in their counties, allocate budget for hymovigilance activities. There could, however, be a light at the end of the tunnel through the Kenya National Blood Transfusion Service Bill 2020 that was tabled by the chairwoman of the Parliamentary Health Committee, Sabine Chege. If passed, the bill will establish KNBTS as a state entity with sole responsibility to regulate and coordinate blood transfusion in Kenya. This means the director of the KNBTS will run a fully functional parastatal with its own funds. It will also mean that the director will have access to the 500 million shilling from the UHC program, as well as 1 billion shilling from the World Bank, intended to strengthen capacity at the KNBTS. The proposed law also prohibits sale of blood, import and export without permission from the Health Cabinet Secretary. Meanwhile, overdependence on schools to get blood has been a major barrier, especially during this COVID-19 period. And now it's a call to Kenyans to come out and donate. Repeat blood donors are encouraged to come out to ensure steady supply of blood.
And I would encourage Kenyans that they donate blood to save a life.
People should know there is a blessing by donating blood.
Every 10 minutes, a patient needs a life-saving unit of blood. At least 1,100 patients need blood every day. Most of this blood is used by mothers and children. The shortage of blood continues to endanger and risk the lives of pregnant women and their unborn children, a factor that continues to drive up both maternal and infant mortality rates. You and I can make the difference by becoming regular blood donors, ensuring a consistent supply of blood to the national and county blood banks, making it easier for mothers across the country to stay alive.